have to leave in about an hour to go to the hospital to meet with the surgeon for today. I'm nervous. Actually, I don't know that nervous is the right word. It's mostly just, I'm worried. I feel worried is maybe more accurate. I am afraid that he will not listen to me. I am afraid that he will talk over me. I am afraid that he will interrupt. I am afraid that he will try to rush the conversation. I am afraid that he will not understand. I am afraid that he will not be humble in the face of maybe I'm bringing new information to him. I am afraid that he will belittle and invalidate my experience. Folks with endo have these kinds of horrible interactions with doctors all the time. All the time. So maybe for your own personal experience, it doesn't seem like, no, a doctor wouldn't be dismissive. A doctor wouldn't be that horrible, right? No, yeah. This is our experience. This is a disease that even in the research that I've done this week, I have seen some new information. Endometriosis affects as many people in the world as diabetes and asthma do. It's that common, and yet it's still shrouded in mystery for so many doctors because the research that's being done is being done by like independent patient advocacy groups. It's not being done in med school. It's not being taught to the people who are specializing in gynecology. It's not being taught to the people who are specializing in gastroenterology and these other systems that are all like next to each other in the body. And so much of the information that I have found has been online through these support organizations and foundations. Endo What is a great example. The Endometriosis Foundation of America is another great example. There are so few specialists who actually are really knowledgeable about this, which is the problem, right? I know of several specialists who work in an office in the building across the street from the hospital I'm going to today. And it's like so close yet so far. But one is paid for and one is not. And we can't ignore financial accessibility. Anyway, this was supposed to be about how this will be the first male gynecologist that I will have seen since the very first one, who ignored me for about 5 years, gave me incomplete information, and who prescribed medications to me as a treatment for endometriosis that ultimately affected my body so much more negatively than they did positively. Gender bias exists in medicine maybe more staunchly than anywhere else. We know this, right? That your gender should not affect your ability to be a good doctor. We know this. And yet, there are ways in which your doctor's lived experience can affect you as a patient. I have been able to find more consistent care with the female gynecologists that I have seen over the years than with my first doctor, who invalidated me at every single turn. I'm hoping that today is different. I am hoping that when I go in there, he sits and is calm and is attentive and is patient and actually tries to get to know me, because we've never met before, so we need to do the get to know you thing. And I am bringing a literal folder of information with me. I have printed out articles. I have printed out sheets that I've downloaded from some of the endo resources that have like questions you can ask your doctor, and I've highlighted some of the ones that I really want to focus on. I've downloaded like a pain chart that I've checked off all the things on, and I'm fully prepared to just hand them this packet and be like, hi, please be educated. If you're not aware of these things, I need you to be. And I'm hoping that he is willing to listen to me and willing to take my input, because a good doctor should be that. Here's what I'm also hoping for. I am also hopeful that if through our conversation he recognizes that maybe I'm bringing something to him that is outside of the scope of what he knows and what he has done, that he will admit that he will say, I don't know everything yet, that he will admit, I don't know if I'm exactly the right person, and that he can maybe then point me to who is. The system of doctors that like I'm going to, like that office has so many people working there. There has to be someone else in that office who is capable, or who is at least willing to try and get more knowledgeable about this. And depending on how this conversation goes today, I don't want to just give up on this I don't want to just give up on this particular team of doctors, because again, they are covered by my insurance, and the specialist I would actually like to go see is not. So if you got an extra $20,000 just lying around and want to help your girl get cut open, I will gladly take it. But until that point, until I can afford to go see the people I would actually like to see, I'm trying to... I am purposefully trying to exhaust all of my options. Which is just such an ironic phrase, because endo is exhausting. Today I feel foggy. I feel sore and achy all over my body. I'm having a headache coming on that's one of those that's concentrated right here, so like my whole kind of facial structure hurts. This is the kind of day where I would just want to curl up in bed and watch movies or something and like not talk to anyone. But I gotta go. I am afraid that this doctor's appointment will be just like so many of the other doctor's appointments that I've had over the last 15 years plus, that I will end up leaving feeling depleted, feeling like I wasn't quite listened to, feeling like I wasn't quite understood. And like I have to start all over at square one again. I'm afraid today will feel like a waste of time. I shouldn't have to walk in there with a packet of research to educate my doctor. Who does that? Who has to educate their doctor on their disease? I will film again after I get home. And hopefully it won't be a sad update. Is that too much to ask for? See you then.
I mean, it was good? Question mark? I'm still processing how I feel about the consult today. There were a lot of things about it that were actually very good. That they were. It was not a bad appointment. I did not leave in tears, and I do think that we got the process started for doing the things that I want to do. I did, however, leave feeling a little disappointed and defeated in a way, and I'm going to try to unpack that now. So, it's very interesting meeting a doctor or anyone really for the first time during this current cultural moment where you have no concept of what they look like without a face mask. Because he was wearing a mask and a face shield, the only part of his face that I could see were just his brow line and his eyes. And he has quite a strong brow line, and so even though he may have been saying something jovially and may have laughed, he looked angry most of the time, which I don't think is his fault. I think it's just the fact that he's got a strong brow and this whole part was covered and he looks very intense. So it was a little hard to figure out kind of his general tone from his very limited facial expressions. He wasn't giving me a whole lot of eyebrow choreography. So he met with me for 45 minutes, which is so much longer than any other doctor has ever met with me for uh, for just a regular consultation where we're just sitting and having a conversation and no exam or procedure is being done. 45 minutes is often unheard of, I feel like, for this kind of thing. So I'm very grateful that he actually spent that time with me today. I do believe that he was being as direct and as transparent as he could be with regards to what he knows about endometriosis and related issues. He was saying a lot of things that were backed up by the research that I have found, so that did make me feel good. There were a few things, though, that I challenged him on, which I don't think he loved being challenged. He was just doing his best to answer my very specific questions with his expertise, and I think he was trying to stand by and back up his expertise because he is a doctor who works with this, so he believes what he is saying. It's like what the dungeon master will say when you are inquiring if someone is lying, and they will tell you, he seems to believe what he is telling you. Instead of saying they're telling the truth, he seems to believe what he is telling you. It definitely was a little bit of that feeling. So, at least he stands by what he thinks. Anyway, this got off topic. Ultimately, he did validate that endometriosis ruins people's lives and that I need to be on a different treatment plan and that I should have access to pain medication because I am in pain every day, all day long, all of the time. And that makes my life difficult to live, and it makes it hard to exist. And he's actually the first doctor who's ever actually given me pain medication for this, and I am actually really grateful for that he sees this as, he understands that this is a big enough deal, that it's to that level, that he believes that I'm in pain. Saying that out loud now actually makes me a little emotional. We did discuss my desires to have surgery, to have excision, which is to actually cut out all of the endo that is found, cut it out at the root so that it does not grow back. And we discussed the intricacies and the logistics of insurance. I have been so sick this year that I met my deductible within like the first couple weeks of January. So right now, insurance is covering pretty much everything. So I would like to get as much done as humanly possible between now and the end of December. And he understands that and he respects that timeline. So he's going to try and help me with that, which I appreciate. He did order an MRI, which I called and got scheduled for November. We discussed doing a mid-December surgery, and he also discussed with me the issues with insurance regarding things like the MRI. I've been having so much pain that has sort of radiated all over my abdomen, like my entire torso, and normally for this kind of thing, insurance will only approve just a pelvic MRI of just the lower abdomen pelvic region. And I was asking, can you really not like look up toward the lungs? Like, I mean, I'm attached to the pelvis. I'm gonna be right there anyway. You could just move the camera, like just push me in the machine a little bit more. And he was explaining that oftentimes insurance will only approve the first one, but that he will try to order the full abdominal region, and that he will put in there that he intends to operate and that he needs to know what he's dealing with. Endometriosis is not something that typically shows up on scans. Like, it definitely doesn't show up on x-rays, it doesn't show up on ultrasounds, CAT scans, things like that. I have never had a doctor agree to do an MRI for me just to see. MRIs are usually the more kind of in-depth imaging. So it's happening in November. We will then have a follow-up appointment to discuss how that looks. Because I've not had one before, it is possible that some things that didn't show up on ultrasounds may show up there, and this way he at least is fully aware of what's going on before he cuts me open, so it's not a blind surgery. This way he can also anticipate whether or not he needs to pull in other surgeons. I did appreciate that he said this, that, if I'm trying to have surgery, but my endo has spread and progressed to the point that it's also all over my bowels, or it's also up on my lungs, or whatever, that he needs to have a different surgeon who specializes in those areas present. And I really appreciate that, because not every gynecologists don't work on those other parts, and a lot of endo specialists even are not skilled at working on those other parts. It's still a very kind of niche practice to be a specialist who focuses on reproductive disease, but who can also perform the necessary resections on other organ systems. And I appreciate that he was transparent with me about that. So from this information, it sounds like everything went great, right? He showed me stuff on the computer, he was transparent with me, he answered all my questions, he agreed to do an MRI and has agreed to do surgery and is willing to go down that path with me, the one that I have set out. And all of that seems great. I will tell you that I had anticipated feeling incredibly emotional leaving that appointment today. Either I was going to be on a really high, feeling incredibly validated and just absolutely amazed at the care that I had received, or that I was going to be devastated because I had gone to yet another doctor's visit where I was talked over or not listened to or whatever the case may be, and feeling like I hit another dead end and like I wasted my afternoon going to someone who didn't understand, right? I was anticipating like one of those two reactions. And that's not what happened. I ended up leaving today feeling depleted and defeated and uncomfortable for all the good that happened in this appointment. I don't, the thing that was missing that I really needed was an atmosphere of true empathy and compassion. It was nice to hear him say the words, this disease ruins lives, and it's very frustrating for patients and doctors alike because it's kind of an enigma, right? It affects everybody differently, and there's still so much that's unknown about exactly where it comes from, and it's not curable. It's only manageable. It's not curable. And he's saying these things, but all I'm getting is the angry brow, and I wasn't getting that kind of emotional validation, I guess, that I apparently really needed. And I think that's twofold. I think, one, it has to do with the fact that while this guy may be super direct and transparent, his bedside manner is maybe not the friendliest. And it has to do with the fact that he is just one in a very, very, very long line of doctors that I've seen who have not met me with compassion and empathy, and I'm really craving that at this point in my illness. I'm craving true understanding from someone. I am craving that feeling of when you spill your heart to a friend and they look at you like they're really hearing you, and that they can see your pain and that they can understand the gravity of it. How when I talk to my therapist, the way that she can do that same thing of really hear me and understand the gravity of what it is that I've said. And I was really missing that today. Another part of this situation that makes me feel a little defeated is that I do not feel like I communicated as well as I wanted to. And this is difficult because one of the most frustrating symptoms of endo is what they call brain fog, that you are just I feel every day as if I am having to trek through sludge in my own mind, as if I have been trapped in quicksand and I am crawling and crawling to get out of it, and I just can't manage to get free. And this affects my ability to have quick cognition. It takes me longer to understand and process things now than it used to. It also takes me longer to formulate the literal sentences that I want to say to someone about something. I literally feel like my access to the English language has just kind of blown up. Like I lost my dictionary. I lost my internal vocabulary, and it is so hard to mentally find the words that I want to use to explain how I feel about something or to explain what I mean about something. And so today, even though I had notes and even though I had my research, it was really hard to explain to him that these are my symptoms, and this is my backstory, and this is why I'm here seeing you, and this is why I brought a stack of research, and this is why I need you to talk to me with compassion and empathy, and this is why I need us to have a good working relationship and to be in community together, because I need so desperately understanding and equal footing from a healthcare professional. I need compassionate, healing care from you. And I couldn't say any of that. 75% of what I just said didn't come out of my mouth at all, and the other 25% I botched in some way, shape, or form this afternoon. Now, I do want to recognize that at the time, I did my best. I did my best to speak clearly and to ask the questions that I really needed answered right then, and to give him the information that I thought was most pertinent. I do think that I did my best this afternoon. So I'm trying really hard not to beat myself up about this communication issue, right? Because I acknowledge that it is literally a further symptom of my disease. I am so tired, I am so fatigued, I'm in so much pain all the time, I cannot think. Oh, that just made me emotional. So I left today feeling like some good stuff happened, but it was sort of overshadowed by this overall atmosphere of, man, I don't feel like we had the kind of conversation that I really wanted to have. I don't feel like we connected the way I really needed to. And I will say there were times that I don't think he let me talk for long enough, and that he was cutting me off, or I would be saying something and he would interrupt, and then I would try to interject again to complete my thought, and he would just barrel on with whatever it was that he was saying. And that's something that has been an issue with doctors my whole life, and they just start vomiting information at you, to try and solve it and figure it out and go ahead and solve that problem and get it done. But that, like, isn't actually helpful. And I wish someone would tell them that, because I've tried and they talked over me. I will say that because of how I left that office today, I do feel a little nervous about the relationship aspect. That the next time I see him will likely be after the MRI, and it will be the pre-surgery consultation. And then the next time I see him, I will not be awake. And you want to trust your doctors. You want to feel confident about them. And right now, I don't know that I feel that way. I do think that he is intelligent. I do think that he has the information, and I do think that he will do right by me from a medical standpoint. We're just not in community with one another at this point, to kind of say it that way, to frame it that way. We don't have a relationship, you know. the previous gynecologist that I was seeing, who is the colleague of the doctor I saw today, she's the one who referred me to him, based on what I was talking to her about, um, based on the way that my disease is progressing and the way that my pain is just no longer manageable. And it would be one thing if I were having these conversations with her because I've known her longer and I've had more conversations with her. So we were at that point where I felt like I could get that sort of empathy and compassion. So maybe I just need time with this new guy. I will say it was a little strange to be talking to him. He is the first male gynecologist that I have met with since my very first one ever, who is the one that delayed my diagnosis by an additional 5 years by telling me that I was just a stressed out teenager and that it was normal and all in my head. And then he, of course, was the one who did the first surgery, but it was surrounded by misinformation, and had I known then what I know now, I would have asked for a different experience altogether. He did ablation, which is basically just where they burn off kind of the top layer of the endolesions, rather than excision, which is cutting out the entirety of the lesion so that it doesn't grow back. It's kind of like getting rid of the surface doesn't actually affect the iceberg that's underneath. All in all, I'm okay. Been feeling a little strange as I process the events of today and kind of how I feel and what I think about everything. I am hoping that this is the right choice. I'm hoping that he is the right person. And we'll see. So I'm going to go lay down because it is a big struggle to sit up straight right now. So I will catch you later, dudes. Yeah, no, I didn't like it either.
Hello, this is Emma from 2 days later, on painkillers. So, enjoy that. There are a couple of things that I did not say in my post-consult video that I was afraid to voice because I had not finished processing them yet. Perhaps I should have waited a little bit longer to film that section, but I was struggling with really being able to process it, and I just wanted to be able to talk it out and thought that would be helpful, and I filmed it, so that is what I did. Here are the things that I didn't mention. The reason why I came away from the appointment feeling so kind of defeated and uncomfortable wasn't just because I was super brain foggy and he interrupted me a couple times. He actually said a few things that made me uncomfortable, and I didn't mention that part. There were a few times where I, in asking specific questions that were potentially challenging to what he was saying, he was doubling down on his reasons for why he was saying what he was saying and made comments that felt a little insensitive. And they were subtle. They weren't these overt, horrible statements, right? Like, when we think about insensitive remarks, we think about somebody saying something that's gonna make us gasp and go, oh my goodness, how could they say such a thing? No, it was really subtle, so it was very hard for me in the moment to go, wait, that doesn't that doesn't quite sit right with me, but I'm not sure how to how to combat it or how to respond, especially because I was exhausted. I was already brain foggy and I was struggling to just get out the words that I was trying to get out in the first place. So uh, I was having a hard time being able to really respond in the way that I would, in hindsight, wish that I could have. I have mentioned that there is a specialist here in Atlanta that I would really like to go see, but that they are out of network for all insurances. Therefore, they are going to be very, very expensive for me to go to, which is why I am sticking with my current team of doctors, because they are covered by insurance. So I am exhausting all of the more affordable options before I go to this other specialist. I would still like to go get a second opinion from them, but I actually asked the doctor that I saw uh, if he knew about them or if he had any kind of working relationship or anything with them, and he is aware of them. He does not know them personally, and he doesn't really work with them at all because they are in different hospital systems. But he knows of them, and he is actually the first person that I have found to have a critique of this specialist. He made sure to repeat and to kind of strongly affirm that there is nothing wrong with that particular team of doctors and that particular specialist, that they are incredible surgeons, that they are excellent at what they do. His only critique was that because they only focus on endo, that they've sort of boxed themselves into like a niche kind of market, I guess. And he said something that surprised me actually, which is that you know, he occasionally sees people who come from them to him to get a second opinion. And he also is aware that it goes the other way around, that he sees people who then go to them for a second opinion. So, you know, he's aware that we're all kind of doing the same thing, and we're just trying to help people, and people are just trying to get the care that they need. But it was interesting to sort of like hear him criticize the person I want to be going to, even if it was in a small way. There were just a couple of things that he said that did not sit well with me. So in addition to the kind of the majority of the way that he spoke was it was direct, but it was also sterile. So that is why I felt like I was missing that compassionate kind of relationship building aspect. He was speaking to me very clinically, so it didn't feel like it didn't feel warm. I think that's a good word for it. There wasn't a whole lot of warmth in the conversation, so I didn't feel good about being able to kind of breathe and relax and go, oh, okay, this guy gets it, and I can trust that I'm in good hands here. There was a point where he where I felt actually kind of stupid for bringing the research with me. And I remember even in that moment, as soon as I felt that way, internally I reminded myself, no, don't feel stupid. You're trying to advocate for yourself. And this is what you felt you had to do. And that is okay, and that is valid. And I do still believe that. I hate that I felt stupid. And the way he was responding to my stack of papers is kind of what made me feel that way. At one point I tried to hand it to him, and he said he didn't want those papers. He only wanted the sheet that had my list of symptoms written down, which on the one hand is fine, because as a doctor who works in this field, my research hopefully was just information he already knew. What I wish had happened, though, was that he would have said, "Oh, you brought some things with you. Let me take a quick look at them and see if I can answer any of these questions for you." And then actually look at them and go, "Yeah, oh, I haven't read this article yet. Can I hang on to this?" Because it was an article that had been published literally the day before I went to the appointment. Or, he could have looked at it and said, "Yeah, actually, this is what we're talking about. Let me give you a little bit of background on the way that I do surgeries and etc." You know what I mean? Like, I wish he had been more open, been more accepting of what I had brought. I think a lot of times doctors forget just how much baggage their patients come to them with. Years of physical pain, years of not being listened to, therefore, years of insecurity and fear over not being listened to. And so I'm walking into him feeling like I have to fight for a voice in that room. And I wish he had A, recognized that, or B, just like stopped long enough to sort of investigate, oh, why is this patient coming to me with a folder of paperwork? Like, why is she asking these specific questions? Oh, because she's been mistreated in the past. She has experienced bad treatment from doctors, and I can be the one to turn this around for her, because this is the thing that I do, and this is the thing that I'm passionate about, and this is my field. That is what I wish had happened. And I just wanted to make that known before posting this video, because I felt uncomfortable saying it the first time. One of the comments that he made was specifically in regards to removal of the uterus, which is called a hysterectomy. All of the research that I have found has stated that for endo, a hysterectomy has often been recommended to women as this kind of like big cure, right? Take out the uterus and then no more lady problems. But that's actually incorrect. Like, a hysterectomy doesn't just get rid of endo. That's kind of the point. Endo exists independent of the uterus itself. And if anything, the relationship between the ovaries and like estrogen creation and all of that may affect endo more than the presence of the uterus does. And but if you take the ovaries, you get put into menopause, which is a whole other host of things. So everything I've seen has said that a hysterectomy does not cure endo, and you should not feel like you are forced to have an organ removed, especially because so many people with endo also have their fertility destroyed by this disease. And a lot of these people want to have biological children, and it's heartbreaking to be told the only way to cure your disease is to get rid of the organ that allows you to be able to carry a child, and then to go through that experience and for your endo to still be there. Like, there are tons of people who have that as their story, and it's so heartbreaking. So he was talking to me about that as an option. He asked me about my fertility and said, we haven't discussed your fertility yet, but I'm assuming you want to keep your options open. And I said, no. I am never having a child from my body, period. Like, it's never happening. I wanted them to take everything out of me back when I was 20 years old, and they wouldn't. For that same reason, that they think that I'm too young to be able to make that kind of decision about my body, and that I'm just automatically going to give birth at some point because I'm a woman and that's my job in society, right? That's a whole other soapbox. But after I said that, he started talking about, depending on what we find, that could be an option for us. And I said, well, everything I've seen shows that hysterectomy doesn't actually cure endo, and he kind of jumped on that comment and said it's 75% effective. And I was like, okay, that's not 100. I haven't seen 75%, but okay. And he kind of kept pushing, and it was very, you know, made me feel like he was, that was the first comment that felt like he was sort of, that it was biting a little bit. That he was challenging me back to try to get me to stop challenging him. That it's 75% effective, and that means that 1 in 4 women is still going to have problems, but at least the other 3 are fine. And I was like, right, but like 25% is a lot. And he said, yeah, and that one woman is probably, you know, and that's probably all you're hearing about because they're the ones writing the endo blogs, right? And the way he said that was just, did not sit well with me. And again, it was subtle. It was one of those things where in the moment I couldn't stop and go, whoa, 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 that, what are you belittling patients writing about their experiences and sharing them online? Because the only reason I know what I know about this disease is because of the communities of people online who have rallied together about this. Like, nobody makes fun of breast cancer survivors for having support groups and doing their 5Ks. Nobody makes fun of cancer patients for doing the same thing, but you're going to make fun of women with this debilitating disease that you've already said ruins lives, and that I shouldn't, tell me that I shouldn't be putting so much credence in the words of the woman who decided to share her story on the internet, her heartbreaking story where she had to go through medical trauma that ended up not solving her pain. So I don't know if it is obvious why I didn't share these things. I hadn't quite processed all of them yet, but the too long didn't watch version of this video, because this video is probably gotten way, way, way too long, is he did the logistical things that I wanted him to do. He gave me pain medication, he set up an MRI, we discussed surgery, and we discussed a potential date for surgery that is less than 2 months out. However, I do not feel like I have a compassionate, trusting relationship with this doctor at all. I do not know him at all. Some of the comments he made felt sexist, felt super gender biased, felt a little aggressive, when all I was doing was trying to ask for clarity on certain aspects of the medical thing we were talking about. So I left that office having been talked over, interrupted, feeling like I didn't get to say what I wanted to say because of my own brain fogginess, and that I didn't get to say what I wanted to say because I wasn't really effectively being listened to. But like, I got the things that I wanted, so I feel conflicted about that. I feel conflicted. And I just wanted to say that. And I probably could have just taken out that whole other portion and just put this in. But I think it's important for when I look back at this journey that I actually see the process that I went through. So. I think that's all I have to say for now. If you have watched this far, thank you. And stay safe.